Now that boys are becoming teenagers, we're having to teach them to be more independent. As the boys, they're inclined to let anyone do anything for them, and they're very lazy by nature. So they don't want to do stuff for themselves, but they're beginning to realise that if they don't have physiotherapy, they don't feel as well. And they realise that they have to take their tablets and their medication. We've got little routines that we try and keep their routines so that they know that as soon as they're coming from school, they have to take particular medication. And we tell them that after 7:30 they have to start their nebulizer routine and everything else. But Greg is brain is like a sieve sometimes, so he's particularly bad at routine. So he actually has a chart that it says he has to do all these things before he leaves the house in the morning. So most children just have to get dressed, have a wash, get dressed, clean their teeth, and have the breakfast, probably not in that order. But Greg has to remember to do his nebulizers, his physio, make sure he has his medication to take with him to school, and all of those things. So we need to make sure that we do that. So it is difficult with teenage kids because they don't want to do things and they know best, and so we're hoping that they're learning, and that by knowing that if they do miss a physio session, they don't feel very well, that they're managed to learn it from sometimes by the hard way. So, and they're becoming more independent, talking to the doctors themselves, and being keener to talk to the doctors without mum and dad being there. So we're getting there, but it's a long way to go.
One thing that I've done all my life is warn a medic alert, because I think it's quite important that if I'm in some kind of horrible accident, like anyone could be, not because of PCD, if I'm hit by a truck or if I keel over in a shopping centre, I would really like someone to be able to find my heart in a hurry. If anyone's in a hurry to find my appendix, I'd also like them to have a helping hand. So I've warned a medic alert, and I think that's quite important to do. And even with PCD, if you were taken ill for whatever reason someone didn't know, it'd be really useful to have that way of signalling it. It's a bit of a pain having to wear a medical all the time, but when it comes down to it, I found my own way to wear it. I think I use the pendant off a bracelet and put it around my neck just because I prefer the look of it. And I wouldn't say don't consider getting a tattoo, just kind of here's my heart. But I just whatever works best for you, I guess. I would recommend wearing one there.
The aim of our diagnostic and treatment service is to try and get patients as early as possible. So the ideal situation for us is to have a baby or a very young child come to us with a suspicion that they may have PCD, and for us to diagnose and start management very early. We obviously have patients coming at all ages, including into the adult clinic where they have not been diagnosed with this. But probably one of the most problematical stages of dealing with PCD is through the teenage years, whether you've had them from day one or whether you've recently had them come into your clinic and have their diagnosis made. And there's lots of problems with being a teenager that exacerbate the management of primary ciliary dyskinesia. The issues that we particularly deal with are desire for teenagers to exert their own independence, probably a desire to simultaneously maybe not embrace the responsibility that their treatments demand of them, an increase in risk-taking behaviour, such as smoking or not complying, because teenagers just want to be normal. They want to be right in the middle of their peer group doing exactly what their peer group does. And so at the Brompton here we've developed more recently a specialised service for our teenage patients. And this is partly to address the problems that go with having any chronic illness when you're a teenager, and partly to try and smooth their transition into adult care. And we have taken a lot of advice and worked closely with the family support group to produce literature and research the issues that really present themselves as additional problems during the teenage years. And that literature and our specialist clinics are very much aimed at teenagers. We don't bring in the non-teen patients to these clinics, so that they can read the literature, have a much more adult approach to coming to clinic. They can see the nurses, the physios and the doctors on their own if they want. They can do a combination of coming in with their parents and coming in on their own. And it gives them a much more adult environment, which we hope will encourage them to talk about the things that worry them, the difficulties they're having at school, the difficulties they might be having with their peer group, who find it difficult to understand some of the commitments that patients with PCD have in terms of time to do physio, time to do nebulizers, time off school because they have to go into hospital for prolonged periods of time for IV antibiotics. All of those things that might bring them out of their peer group for periods of time and then maybe make it slightly difficult coming back into their peer group. And so this service of ours is designed for them to hopefully come to us with their problems and for us to try and tease those things out of reticent teenagers. And one of the other roles that we have in that service is probably to try and make teenagers see a little bit into the future. So discuss their career options and talking about their aspirations and what they might want to go off and do as a young adult is a very good way to bring back to them why it's so important to look after themselves now, so that they can have all those choices when they're a bit older. Because we want them all to go into the adult clinic with good lung function. We want them all to be able to say, I'm going to university to do this, or I'm going to college, or I want to go and travel for a year, and then I want to be an accountant or a jockey or whatever it might be. So we want them to be able to have those choices. And that really depends on them learning to take responsibility for themselves so that they can actually keep themselves well. It's not up to mum and dad anymore when you become an adult. And I think the teenage years are the time that we have to start transitioning them into taking that responsibility whilst they're still under our slightly paternalistic care, if you like.